Judy. I'm your nurse, and I'm here to do a musculoskeletal assessment, which is just going to check your head-to-toe muscle strength, range of motion, and skeletal system. Can you tell me your name and date of birth, please?
Caroline Blessen, 4/12/1980.
I'm just verifying that with your wristband. Okay, so what I'm going to do is work from your head down to your feet, checking, observing, and giving you some movements to do to check the health of your musculoskeletal system. Is that all right?
Yes.
Do you have any questions?
No.
Okay, the first thing I'm going to do is palpate your face. There are some muscles in your jaw. I'm palpating for tenderness. You let me know if anything's uncomfortable.
Mm-hmm.
Okay, and can you clench your jaw for me? Very good. And relax. Very good. Is there any tenderness in your TMJ?
No.
Okay. And anything along here? Okay. So now what I'm going to do is ask you to do some movements for me. I want you to drop your chin to your chest. Good. And relax back to neutral. And can you turn your nose to the right? Good. And bring it back to center. And can you turn your nose to the left? Does that cause any pain or discomfort? No. Okay. Can you drop your right ear to your right shoulder, please? It's not a test. Thank you. Good. And drop your left ear to your left shoulder. Good. Okay. Now I'm going to ask you to move your arms, but first I want to palpate and observe. I'm going to assess your shoulder joint and clavicle and scapula. Everything feels good? Any discomfort?
No.
On this side?
Nope.
Okay, check your sternum. Okay. Now, can you bring your arms straight in front of you toward me? Okay, and back down to your side. Any discomfort?
Nope.
Can you bring your arms out to your side? Okay, any discomfort?
No.
Okay, good. Now I want to look at your elbows. Okay, I'm going to check the elbow area. And your wrist while I'm here. And your fingers. No deformities. No deformities or discoloration. Okay, now I want you to bend this elbow up as far as you can. Any discomfort? And bend your wrist. Okay, and then bend it the other way. Down. Great. Now we're going to check your fingers. Can you make a fist? And can you spread your fingers out? And can you bend your fingers the other way? Okay, very good. Very good. And spread your fingers out as far as you can. And now push them together as tight as you can. Any discomfort? Okay, very good. Now I'm going to test your strength. I'm going to ask you to raise your arm against my pressure. Okay, now do that with a straight arm. Bring it up, bring it up. Okay. Now I'm going to do it out to the side. Bring it up. Okay. Now I'm going to ask you to bring it down. Okay, very good. And now I'm going to ask you to bring it down. Good. Now we'll relax that arm and we're going to check the other arm. We're going to look at your elbow to make sure there's no deformity or discoloration. We're going to check your wrist. Any discoloration, deformity? No? Any pains? Any reason for me to believe there might be a problem?
Nope.
Any history of injuries or fractures or anything?
Nope.
Okay. Bend this elbow. Good. Straighten it. Bend the wrist. And straighten it. And bend your fingers into a fist. And bend them the other way, opposite. Good. Now spread them out as far as you can. And bring them together as tight as you can. Good. Any discomfort?
No.
Going to test your strength. If you can bring a straight arm. Lift up. Okay. Now we're going to put it out to the side. Lift up. Good. Now press down. Good. And now press down. Good. Okay. Now I want to check your knees. I'm going to observe your kneecap. Any discomfort in your knees?
Nope.
Any history of knee problems?
No.
Do you do any exercise,
Yes.
jogging? Okay. And check your ankles. Any discomfort or problems with your ankles?
No.
And your toes?
No.
Okay. No deformity, no discoloration. Okay, so I'm going to ask you to straighten this leg. Okay, and down. And straighten this leg. And down. And bring your toes up on this foot and press your toes down. Okay, toes up on this foot and press your toes down. Good. Now, can you stand up comfortably? I'm going to check your hips and pelvis. Any discomfort?
No.
Okay. Can you lift your legs straight in front of you? Okay, good. That's great. And can you lift the other leg? Very good. Now, can you move forward, and I want you to point your leg behind you. Okay, good. And the other one? Good. Now I need you to turn around and I'm going to check your back. I want to check for scoliosis or kyphosis. I'm just palpating your spine. Everything feels straight. Any history of spinal issues? And your hips feel even, your shoulders feel even. Can you bend forward very slowly, very slowly, very slowly, very slowly? Okay, feels good, and come up slowly. Everything feels straight. Okay. Okay, and let's see, sit back down. I need to check your strength of your legs. So I'm going to ask you to lift your knee up, okay, and bring it down. Okay, and lift your knee up, good, and bring it down. Okay, now straighten this leg, bring the leg up, good. Now bring it down, okay, bring this leg up, bring it down, okay, and your feet. I want you to bring your toes toward your nose. Okay, good, relax. And now I want you to press down like you're accelerating. Very good. The last thing is I want you to grip my fingers as hard as you can. Good, and relax. That completes your musculoskeletal assessment. Do you have any questions for me?
No.
Thank you.
Bye.